What about Siobhan? Did she come in or no? Welcome, all of our loyal listeners, to our special medical radio show here on News Talk 760 WJR. I'm AnnMarie Cronin, and we are here tonight to talk to you about prevention and why you need to start looking at healthcare from a different perspective. Dr. Brian Kolender, MD, is joining us from Birmingham, Michigan, to give us some hard talk about dealing with our health and making sure we get the necessary testing. We're inviting you to call in if you have a question at 800-859-0957. Don't miss your opportunity to talk to the doctor directly. Dial 800-859-0957. Dr. Kolender, what's the news of the week? Always good to hear from you.
Well, thanks. I'm not sure the news is great because
we don't want to hear that. Let's start again. Let's start the show again. What's the good news?
The good news is there's always a chance to be healthy. Get the right information that you need. Learn about your personal profile and get to work and figure out how to do it, with help, figure out how to find your weaknesses and make them better so that you don't have chronic illness, that it's preventable.
Well, as a private concierge, personalized physician in primary care, we're kind of sort of, I guess, ebbing out of the COVID 2 years worth of misery. And what are you seeing with your patients that are in your private practice? What are you seeing? What are the ramifications? What's the end result? What do people need to do now that they can get in to see their doctor?
Well, there's still this Omicron variant that's coming around.
But is it, let me stop you there. Is it serious?
No.
Everybody that was dying was with the Delta, right?
No, I'm seeing the Omicron variant as a viral sinus infection that has not responded to anything. So I've tried ivermectin, I've done my supplements, I've even put people on antibiotics, and nothing seems to work. It takes about 7 to 10 days to run its course, and then it's gone. I have not prescribed Paxlovid. I kind of refuse to, which is the Pfizer COVID pill. It might work, but I haven't prescribed it yet because I'm not testing anybody. So I'm not testing for COVID like we said. The Kolender mandates, one of them is don't test anymore because these tests just aren't effective.
So what is Paxlovid for?
For COVID. If
you get a patient that has COVID, is that what you're saying?
That's what it's indicated for by the FDA.
But you're not using it.
I'm not using it. Now, if I thought I needed to use it, I might. But I'm presuming you ought to have COVID to have that drug prescribed. But so many people have negative COVID tests, yet they have COVID symptoms, that I'm not sure testing is warranted anymore. So I'm not testing anybody, but I'm seeing a trend in a complex of symptoms that involve a viral sinus infection. And that's what I think this Omicron variant looks like.
So not nearly as dangerous.
And I'm not seeing that many cases either.
So would you say we're coming to the end of it?
Who knows what is going to happen in the future with COVID, because these variants will never go away, I think. I'm hoping this is it, that it just turns into a common cold. That'd be nice.
Right.
That it just becomes a common cold. Then the question is, again, mandated treatments for a common cold. What does that mean? And, there's some states in our union that are passing laws, or at least putting laws on the books that will, make it illegal for me to talk on the radio. We couldn't have this show in California, AnnMarie.
Okay, why not?
Well, because they're making it illegal to spread misinformation.
Well, you're not spreading misinformation.
Well, you know that, and I know that, and the listeners know that, but the government of California doesn't know that.
Mm-hmm.
So if we're talking, opposite of the FDA and the CDC, which we've already established as corrupt agencies, they've established themselves as corrupt by hiding information and data about the complications of getting the vaccine, then if we were telling the truth, we would be arrested. I don't know about arrested, but law enforcement would be given the rights to take action against us.
It's a scary thought.
It is scary. So it's not so great out there. So here we are, no one's paying attention to COVID anymore. And, while it's quiet, the government is, certain state governments are taking drastic action to remove our rights.
Well, one good thing is that, we at least have the ability to talk to our patients and tell the listeners what they ought to do. And I think that's great that you're still on the air. We have one caller. Do you want to, Ashley, want to take the caller?
Yes, we have Greg calling from Shelby. Greg, what's your question?
Hey, AnnMarie, Dr. Kolender, Mr. Positive. Hey, real quick, when we talk about heart attack, stroke, and blood clots, I bring it up on Facebook, and no one seems to know about it. Factor V Leiden, which I have. And people are getting blood clots on a very regular basis, and then when I bring it up, they go, oh, my God, never heard of this. And then they go to their doctor, and they check for it, and then they've got it. And it's a very prevalent condition for people that get blood clots easy, arguably to cause strokes and heart attacks. But if you can, inform the public about Factor V Leiden. I'll hang up, and thanks for being you, Dr. Kolender. You're awesome.
Well, thank you, and
gosh.
we'll have to do that at the next break because we're at the end of this segment, but we'll start the show with Factor V.
Yeah, interesting question, but let's come back and discuss this on the other side of the break. Again, you're listening to our special live broadcast, and we are here with Dr. Brian Kolender, MD, talking about prevention. If you have a specific question and you'd like to talk to the doctor directly about what you need to do to prevent catastrophic disease, please call us at 800-859-0957. Again, that number is 800-859-0957. You're listening to News Talk 760 WJR.
You can we're in Facebook now. You can do the opening now.
We're doing the
Yeah, go to
right.
the opening. We got
All right. So all of us, is Facebook working? Is Facebook up and running and it's working?
Yeah,
And
it's
that's
up.
great. So hi to all of our listeners in Korea that if we get bumped off a show, they get really annoyed and they send me emails saying, what happened that you didn't have a show? So I'm sure they're all tuning in, and it's good to know that they're out there.
I think you should do the opening.
How can I do it? Can't go back and do the opening.
Sure, you can. You'll feel better. Like you
No,
got
I
the
won't.
whole
I
show
trust
in.
me. I won't. I trust me. I won't feel better. I don't know how we missed the opening to the show, but they just went ahead and played the music instead without us. But anyway, so we're back talking about the where we're at the end of possibly at the end of COVID and what's happening with patients. None of your patients got sick and they got sick, but they didn't go into the hospital. So
We just don't know where COVID's going, what's going to happen. And, to me, the main message now about COVID is leave people alone. Let people go back to work. Don't mandate a vaccine for a condition that is not that harmful. Now, there are still people dying from COVID. Honestly, I don't see how.
but where
But
are they
they
dying
are.
in the hospital, or are they dying at home, or where are they dying from COVID?
I just know that if you go on the registry, there's, about at least this is the last week, there were about 1,000 people a day dying from COVID around the country. So I don't know how it's happening, to be honest, because I just don't see it as a bad problem. I would look at this as a major access problem. If you have COVID and you have the opportunity to have a conversation with your doctor for them to, guide you through this process, then you'll stay home and gut it out. But if you don't have access to a doctor, you're going to go to the hospital, and the hospital does what the hospital does, which is
Nothing.
admit you, put you on drugs that make you worse.
Mhm.
And again, this is, I got to blame, this is forever blame the FDA and the CDC and intubate you, and they get paid for this. So
Unbelievable.
you just got to, is access to a doctor to talk you through it is one of the great tools that people in this country don't have.
Yeah. Well, we're about ready to go back on the air again. If you're just now joining us, I'd like to let you know that we're welcoming you to our special medical radio show on News Talk 760 WJR. We are back again with Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention in Birmingham, Michigan. Dr. Kolender will talk to us about the tests that we need to get and give us some hard advice on what we need to do to avoid heart attack and stroke altogether. And we're inviting you listeners to call in with your questions at 800-859-0957. Again, that number is 800-859-0957. Dr. Kolender, over the break, you were talking about the collateral damage of COVID and where do we go from here?
Well, we promised Greg a conversation about factor 5.
Right.
Right. So let's do that and then come back to COVID. So factor 5 is one of a handful of conditions that predispose people to blood clots. So there's factor 5, which is a genetic deficiency in a protein. There's also protein C deficiencies, protein S deficiencies. There's something called a lupus anticoagulant, which is a lupus-related condition predisposing people to blood clots. So even though a lot of people carry one of these markers, and factor 5 is one of the more common ones, it does not mean that you're going to get a blood clot. So unfortunately, this is a reactive area where we don't even look for it until I don't draw these tests without a reason. And the reason usually is my patient had a blood clot. So for people that have a blood clot that is not easily explained, I'll run these tests, even during a blood clot or after, because sometimes the status of having a clot will alter the lab results. Just having the clot may interfere with the results. I'll run the tests again afterward when they're treated or off treatment. And if they're positive, it means they need to be on lifelong anticoagulation. And I don't mean, like a blood thinner, like Coumadin. And there's also now several different medicines that help thin the blood that are not Coumadin. So that's what factor 5 is. So it is common, but I don't think it's a good idea to just check it randomly because we really don't have a remedy. So I'm not a fan of doing tests just to see what it is and let's have a remedy for it. So that's one of those areas.
So why are we so concerned about blood clots right now? Is that something that's remnant of the whole COVID experience?
Well, COVID did predispose people to blood clots. So it was a thrombotic disorder, meaning it caused clots. And that was
nothing to do with the vaccine. Let's just be clear. Nothing to do with the vaccine. It had to do with actually having COVID.
Correct.
So
no, remember the Johnson vaccine caused blood clots in women, young women when it first came out.
Right.
And we had whole shows about that.
Right.
And AstraZeneca really never made it to market because of blood clots. So both the vaccine and the disease has some correlation to blood clots.
And so does the general population and general listeners out there, whether or not, I think there's a lot of people out there that had COVID that didn't know they had it.
Oh, agree, 100%.
100%.
And we're learning that those people may be at risk for long-term cardiovascular injury, but without doing the right tests, they're not going to know.
Well, let's talk about this some more, but Ashley is a caller. Ashley was calling.
Yes, we have David calling from Windsor, Ontario, Canada. David, what's your question?
Yes, my question for Dr. Kolender is this. In regards to COVID and other viral illnesses, wouldn't you also recommend therapeutics against vaccines when even the symptoms of colds and flu start coming on? What would you be able to recommend about that other than a vaccine? Because many times some people have negative reactions about that. So what would you recommend for people suffering from any kind of virus at all? Old-fashioned remedies, what about that?
Well, as you know, I'm no longer a fan of the vaccines as a preventive measure because it's clear from the documents released by the FDA recently that there were acknowledged side effects to the vaccine. And we just were not dealt with honestly by the government. We were not given the ability to obtain informed consent. We were told that they were safe, and they're clearly not. Now, it does not mean that people benefited from being vaccinated. It does not mean that the vaccine did not keep people from dying when they were in the hospital, but people have a choice and a right to know what they're being treated with. Everyone asks me, what are the drug interactions and what are the side effects every time I prescribe a drug? Isn't that your common answer? What side effects, drug interactions? Well, we didn't get the opportunity to educate our patients about the vaccine because that data was withheld from us intentionally and purposefully. So, therapeutics. Now I really treat people with viral syndrome with, I'm back to watchful waiting, because I don't think this current variant of COVID is responding to anything. So I'm just waiting. Make sure you take your supplements, Advil or naproxen for joint pain and fever. Make sure you stay hydrated. And I tell my patients to be in touch with me when they get worse so we can adjust the program. It's about access.
Well, absolutely. And your patients are fortunate enough to have access to you because you're a personalized concierge physician with your phone on 24/7, so that if your patients have anything wrong with them or anyone in your type of practice, they can call you on the weekends, the evenings, whenever, explain their symptoms, and you're going to tell them what's the next move, come and see you, go to the hospital, whatever. But for the rest of the massive population that's out there, and they're in what you call population medicine, where they can't even get in to see their doctor. They're just hopelessly lost. And during COVID, it's gotten so much worse because getting access to seeing a specialist or to see your doctor about normal, health problems just doesn't exist anymore because everybody's transferred over to telemedicine, or they're making it so difficult for you to get an appointment that it's impossible.
Well, during COVID, the fallback position has been go to the ER. You're sick, I can't touch you because you might have COVID, go to the ER. And of course, you go to the ER, and then you're on this merry-go-round of hospital therapeutics, which don't help. So, it's all about prevention. It's all about early treatment and adaptation. So, COVID's adapting, and, I'm trying to adapt with it. And I just don't know what the future is going to hold, except hopefully this is the end of it and COVID just turns into being a common cold. And if it is just a common cold, then, there should not be any mandated therapies that are not proven to be safe at all. And that's what we're afraid of now, is that certain states are now passing laws requiring vaccination and making it illegal to speak out against the status quo.
Requiring vaccination for what?
In California, they're
What are they requiring?
that they're requiring that COVID vaccine be part of the childhood vaccine protocol.
Going forward.
Yeah, which again, we're wholly against.
And what about the booster shots?
Well, that's what I mean.
Okay.
The getting vaccinated, getting boosted is all, it's going to be mandated in California that that's what you have to do. And again, we would not be able to have this conversation in California because they're making it illegal to spread misinformation. And again, this is, even though we're not misinforming anybody, the greatest misinformers of all time are the FDA and the CDC. They've broken their trust with the American people.
So what are the average listeners to do? I mean, fortunately, we're here. We're not in California, but still, it's a dodgy question, to say the least. Anyway, right now, we're going to have to take a quick break. Again, you're listening to a special live medical broadcast. If you have a specific question and you would like to talk to the doctor directly about what you ought to do to avoid heart attack and stroke, or if you have a question on any of the subjects we're discussing tonight, please call us at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR.
Let's come back next segment and let's get back to prevention, because you're going to ask, well, what do we do? Well, what we do is get back to the basics.
No, but here's my question that I was thinking about when you were talking about this. I'll bet there were a lot of people out there who got COVID and didn't know they had it, because if they were kind of non-symptomatic, or they might just have thought, I've just got a flu, or I've just got a virus, or I'm just feeling under the weather. I mean, we don't really know how many people really had COVID. But what is the risk of blood clots from people that maybe were undiagnosed from they
Oh,
had
I think
COVID?
none.
None.
The risk is during the active phase of COVID.
I see.
So there's there were a couple phases of treatment. There's like a mild viral syndrome phase where if you were able to get to someone at that point and start early therapeutics, you probably could just turn this into nothing.
Hmm.
But if you let the cytokine storm kick in, let the inflammation brew, and now it turns into a systemic problem,
Hmm.
now you're in trouble.
So at what point does the average out there patient that belongs to your average PCP organization, when they may have gotten sick, at what point do they suspect that this might be COVID and not just something else? Is it
Well,
high fever? Is it what?
well, I mean, I think we're past this point. Like that part of COVID's gone.
Right,
It's gone. There's no more Alpha, Delta,
right.
Omicron. Now we're on this Omicron variant that just causes a sinus infection. So we just don't know. Not
But is it
even.
important? I guess my question to you is, if you just have the mild effects of what seems to be a sinus infection, is it important that you need to go and be tested to see whether you have COVID or not?
I don't think so.
Okay, so you can just stay at home and forget about it. And as long as you're not getting sick, as long as your fever's not too high, as long as you're not having problems with breathing, then why the hell would you bother going to a doctor or a hospital?
I agree. I mean, you should always let your doctor know, hey, this is what's happening, so they're on alert, so that when you call again, they know that there's a problem. I want to know when my patients are not having any kind of problem. So if they call back, I'm like, all right, now we're on level 2.
But that's you, because the rest of the population out there can't even talk to their doctor, even if they belong to a practice, a regular population practice. They're never, ever, ever going to talk to their doctor until they're in the examining room and he walks in for 5 minutes and walks out.
Well, I used to say that the time of letting something run its course has passed with COVID, but maybe it's back. That was only a weeks ago. I was saying you can't let anything by. You've got to address the COVID right away for any upper respiratory type infection. Now that quickly, that's how quickly this thing's changed. Hopefully it's just become the common cold and then we're really just done. But then if it is a common cold, we got to come back to the lid's off the can with his mandate.
Hmm.
That's the problem.
What are we
here
coming
is-
back to talk about?
Well, you always ask, what is the average person supposed to do? So
Right.
let's just go back to basic prevention.
Okay. Welcome back to our special live medical broadcast on News Talk 760 WJR. We are fortunate to have Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, here tonight to give us some straight talk about two important topics: prevention and being proactive. We're inviting you to call in with your questions at 800-859-0957. Again, this is a great opportunity to talk to the doctor directly. If you have any questions, at 800-859-0957. Dr. Kolender, coming back, what is the average listener, the average patient out there? They're not in your type of practice. Your type of practice is 24/7, hands-on, spending an hour with patients, following up when you send patients out to a specialist, What about the rest of the population that's out at sea?
Well, they got to come to shore. They've got to
Good point. Yes.
find someone who's willing to offer this kind of care. They've got to demand it of their doctor. Their doctor should be doing it, and they're not. And shame on the medical profession for not making room for people to get better care. Again, we're not, I'm no longer making excuses, and neither are you. You've been saying this a long time. I finally jumped on board to say we cannot make excuses for doctors because they have a job, because they can't get their charts. They put themselves in the situation where they can't do, it's very difficult to open up a private practice. Well, I did it. And I'd like to say I was one of them, and I still did it. And it's a lot of work. It's scary, but you do it. And at the end of the day, you're very happy you did it because your patients love it and you are practicing a better brand of medicine.
Yeah, I mean, it's a pretty amazing journey that you've gone on, and I just wonder why more doctors don't do it, because I always come back to the thought of you went to medical school to be a doctor, you spent all these years to be a doctor to heal people. You can't heal people in a 2-minute interview with a bunch of Mickey Mouse tests that don't do anything about preventing disease. And so I commend you for what you did. But again, the average listener out there and the average patient out there, they're just lost because they belong to a practice where the care they're getting is shrinking and shrinking and shrinking, and people are dying. We still have almost 700,000 people dying of heart attack in this country when it's totally preventable. So what's the average listener to do?
Well, we can even talk about the tests, but
Right.
what's the purpose? Because you can't get the test anywhere. And even if you get a test, you don't have anyone to treat you or knows what to do with it. And if you take the test, your PCP, they don't know what to do with it. And we can recommend blood tests. I mean, last week I went off on getting a bunch of blood tests for someone who had a heart failure. And you looked at me, you gave me a great side eye.
Mhm.
I'm ruining the show
Mhm.
with talking about too many blood tests. And, the doctors don't even know where to get those tests because you have to have a specialty lab to run them. Because if you ran that through your normal channels, that patient's going to get a multi-$1,000 lab test. But when you do it on a regular basis, you can find ways to do them very inexpensively. So it's not you've got to be ultra rich to do these things. You just have to decide that you want make a better option for yourself and put yourself in a position to be healthy.
That's a tough road, and it's great for all the patients that are in your practice, because of the 300 or more patients that had COVID, none of them died, none of them went into the hospital. They can call you at 11 o'clock at night or 9 o'clock in the morning or over the weekend, and that's great because they have this personalized practice at their disposal, and you shepherd them through when you send them out to specialists. But for the 1.5 million other people that are listening and our audience in Korea and all across the world, I mean, it's like, what does the average patient have to do in order to get into a practice like this or be able to get access to the tests?
Just try.
How do they try?
Well, first call us and we can help. If you're out of the area, we can try to direct you to somebody who might, meaning,
Right.
but what's out of the area to me? I've got patients in every state.
Right.
So, my area is global now.
Right.
We've got patients that live out of the country. And, when they come into Michigan, we see them, and then I still communicate health issues with them, 10 time zones away. So it's just a choice to look and to make the effort. There are people around here that do it, just not many.
Finding a doctor who is a private personalized concierge doctor is difficult enough. Finding one who specializes in prevention, there are so few
Right.
doctors in the state, in the area, that specialize in prevention. And I mean, you can't see all the listeners that are listening to this show, but I mean, it's very important that the listeners know what prevention is. The tests that are out there, we've said this so many times on the show. There are absolute tests that can help you prevent having a heart attack, but they're not covered by insurance. They're not recommended. Your doctor doesn't talk about them. I
and they're
wrote,
not expensive. They're
and they're
really
very
not.
inexpensive.
And so understanding that heart attack and stroke are 100% preventable is really a statement that people cannot wrap their heads around, because it's just accepted that things happen and cannot be stopped.
Right.
So many people drop dead. Everybody knows someone who had a heart attack and died. Everyone
Right.
knows someone who had a catastrophic stroke.
Mm-hmm.
And the take-home message is it could not have been prevented,
Mm-hmm. Mm-hmm.
or it just happened. Because the process isn't understood of how to stop it. And when you understand how simple it is,
Mm-hmm.
it's the same as, again, I'm going to give my COVID analogy. When we talked about this legal document supporting doctors who prescribe ivermectin and hydroxychloroquine, I went on a huge rant this one day on the show because it was so easy to stop COVID and the government didn't let it happen.
Well, I know there's nothing we can do about the government, but we
No.
have Ashley. You have a caller?
Yes, we have Don calling from Macomb. Don, what's your question?
Well, I hear a lot of talk about heart prevention, problem prevention, but you're an internist, I understand, right? Or,
Yes, I
or
am.
am I wrong?
No,
Mhm.
you're right. Do you have a
So,
question, Don?
Well, I just wonder, do you, doctor on for heart patients?
Well, Don, medical management is the way to prevent disease. And there's studies supporting that a medical management process is as good as a procedure like a stent or bypass surgery for people with unstable angina, which is, I would consider, a very substantial problem. Yet medical management is as good. So you do not need to be a specialist to apply optimal medical management to somebody in need. You just have to have the desire and the will to do it. That's what I'm doing.
And then, in other words, of course, that's what we talk about all the time in this show, is that heart attack and stroke are preventable. And I think that the horrible situation is that nobody knows about what the tests are. Maybe they're not covered by insurance. They don't cost very much. They're non-invasive. They're easy. They're simple. And it's just a matter of finding out what the tests are. And I think that when people find out what the tests are, then they can make an informed decision about availing themselves of the tests or finding out how to get the tests so that they can then, you know, be on a path to prevention.
Well, I think Don was in disbelief that a non-cardiologist was making statements about heart disease and preventing heart attacks. I think that's where he was at.
Well, it doesn't matter. You still went to medical
Right,
school and you know
right.
what you're doing, and none of your patients have died of COVID.
Well, he
so
should listen to the show a little more.
Exactly. Well, in the meantime, we're going to come back and talk about this some more on the other side of the break. You are listening to a special live broadcast from the studios of Startup Nation in downtown Birmingham. And if you have a specific question on the subject we're discussing tonight and you'd like to talk to the doctor directly, please call us at 800-859-0957. Again, that number is 800-859-0957. You're listening to News Talk 760 WJR. Interesting.
Well, he made the effort to call
Yeah.
just to kind of question my credentials.
Well-
I mean, what else are we going to talk about? So,
Well, it doesn't really matter
Yeah.
because actually,
no, I know it doesn't matter. Just,
I mean,
it just,
we've already talked about the fact that sometimes when you get sent on to a cardiologist, that doesn't matter either, because look at that, a listener that wrote in had been to 5 different cardiologists getting nowhere, referring to one to the other, to the other, to the other. It's just like you get kicked around in the system. And it doesn't help you any to be kicked around in the system.
for what cardiologists do best, which is stent blocked arteries,
fixing things that are broken.
treat arrhythmias. There's plenty of disease out there for that. They're just not being paid to the degree that they're used to being compensated to prevent disease.
Right.
So why would they? It's like dentists.
Hmm.
They're getting paid too much to do implants and cosmetic surgery.
Hmm.
Why would they practice preventive dentistry? It's like making 25 cents on the dollar.
Right. Hmm.
Why would they? It's too lucrative to be a cosmetic doctor.
That's absolutely right.
And the science has given every regular dentist the opportunity to be a cosmetic doctor. They all want to do implants
Hmm.
and veneers.
Hmm.
I'm running out of
And
cosmetic,
Invisalign,
right? I'm running out of
Invisalign and-
cosmetic dentistry terms.
Right, exactly.
But because they make too much money. So that chair's got to generate thousands of dollars an hour.
Hmm.
And that does not happen in medical dentistry.
It's kind of a shame because you would think that, that's the first place that, all of this oral investigation works.
Well, it should, but it's not happening. Dentists have understood the systemic nature of oral health for decades, yet here we are. Well, they have no support. They know it's there.
Well, what kind of support should they have, though?
They need medical teammates.
Mm-hmm. Oh, you mean medical doctors?
Right. To
Interesting.
validate what they're doing.
Right.
They've got
Mhm.
nowhere to send anybody.
Yeah, good point. Right.
So if dentists are recognizing a problem, they don't know, there's nowhere for them to go to send their patient to someone who's going to recognize the situation
Mm-hmm.
and say, this person with severe periodontitis with pathogenic bacteria that correlate to dementia, heart attack, and stroke. No doctor knows what to do with that line.
Mm-hmm.
None of them.
Mm-hmm.
So,
Well, the dentists ought to be all doing it. They all ought to be doing the swab to see what's in your mouth, what bacteria is in your mouth. And if they find enough significant bacteria to then tell the patient, you need to go and see a doctor, an MD that's going to follow up with this.
I know, but it's the same question. It's the same question that you keep asking. What does the average person do? There's nowhere to go.
That's kind of a sad
We're in
commentary.
the same place. So,
Right.
so they, a dentist might have been all on it at one point, but then they stop.
Yeah, because there's no money in it. What a shame. Welcome back to the final segment of our special live broadcast here on News Talk 760 WJR on the importance of being proactive and informed of the resources that are available to prevent and treat the chronic and debilitating diseases that we've come to accept as inevitable. You're listening to the expert advice of Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention. If you have a question for the doctor, now is your chance to call us at 800-859-0957. Again, that's 800-859-0957. And I'm also encouraging listeners to tune in to Dr. Kolender. We have a weekly show on Sunday at 3 p.m. where he also disseminates a lot of very important information that you need to know about, not only just about having a personalized concierge practice, but also about how to get engaged with the practice and understand that you can prevent heart attack and stroke. Dr. Kolender, before we come back to you, Ashley, you have a caller?
Yes, we have John calling from Byron. John, what's your question?
Is John still out there? Is he still on the line? John, are you there?
I can hear you.
Okay, John, go ahead. What's your
Hello?
question? What's your question, John?
Brandon, you can't hear me?
We can hear you.
Hello?
Yes, go ahead. What's your question?
Well, I got a Johnson & Johnson vaccine last March or April. A lot in my eye within just a few days.
John, you may have to call back on a better line because your phone's breaking up,
Yeah.
and we appreciate you calling. But call back on a better line,
Yeah,
please.
call another line where we can hear you because you're breaking up, and/or call Dr. Kolender at 866 Kolender. All right, Dr. Kolender, this is our last segment. So, I mean, what is the average listener to do? They're still lost at sea.
Well, the average listener needs to be a better advocate for their health. They need to, again, if you're a listener to this show, you know what's possible. And you need to either call us because we're offering the service you're looking for, or demand it from your doctor, and your doctor can become an expert in prevention. It's really not that hard. You just have to want to be an expert in prevention, and then they can be that for you. And frankly, we need more people out there doing what I'm doing because it just can't be done by so few doctors. And,
Right.
And you mentioned last show, AnnMarie, that the rate of heart attack deaths are actually going up.
Right.
They were 650,000 for decades, and now they're moving up to 700,000.
Right.
Horrible.
And point in fact that I'm not necessarily giving a plug for our media here, but I do want to let you know, listeners, that I did write an article that's going to come out in the Health Guide. I think it's the March issue in the Health Guide, the annual publication, and it does list the tests that you need to be aware of that will help you with prevention to prevent a heart attack. And Olivia, Olivia. Ashley, we're here with you tonight. What do you have a caller?
Yes, we have John calling back from Byron. John, what's your question?
Yeah, last April I got the Johnson & Johnson vaccine shot, and I developed a clot in my eye within a few days after that. And my joints got real swollen, and my gums started bleeding. Now the gum bleeding has gone away. I'm asking to clots from now on, and is there anything I can do to repair the damage that was done?
It's a loaded question. That's a loaded question.
You're lucky you're alive. You're
Yes.
lucky you have vision. I do not believe that you're still at risk for ongoing clots this far out. But we still don't understand the long-term effects of vaccine injury, just like we don't understand the long-term effects of long hauler COVID. They frankly may not be a whole lot different because the vaccine creates the spike protein in our system, which is, whether it's from the vaccine or COVID itself, is what causes the injury to our body. So we don't have answers. I would tell you what I would tell anybody, which is learn about your health, identify your vascular status, and find all the inflammatory drivers of disease that you have, which is what I do on all my patients who have plaque or not. Screen for these conditions because they'll help lower the inflammation in your body in general and hopefully reduce the impact of this vaccine injury to you in the long term. I can't tell you that's going to happen, but that's the best thing I would do.
A lot of people out there with certainly attendant problems to both the COVID and the vaccine. But again, as I said, I think that what's missing out there to the listeners and the general population is them not having a connection to a person who can shepherd them through the process. You have to have a somewhat intimate connection with a doctor that's going to tell you what to do next, where to go, what tests you need. And to be just left out there to, graze in the pasture is something that we need to wake up and do something about. And I'm not holding you as you're a single doctor that went on a crusade. And the crusade worked out very well for all the patients that found you. But for the patients that didn't find you, and for the listeners that are out there that they're stuck in this broken system, I mean, it's a difficult question as to what they ought to do. But Ashley, you have another caller?
Yes, we have Dale calling from Canton. Dan, what's your question?
Yes, doctor. I had COVID last April, and I do have factor V Leiden. And since I had the micro antibody treatment and I recovered from it, but within the last, since the first of the year, my PT INR, I haven't been able to get it stabilized. And I'm running thick, and I'm very fatigued all the time. Is there anything that I should be concerned about?
Did you say that you had a blood clot or not?
Oh, yeah, yes. I have factor V. I've had half a dozen pulmonary embolisms since 1997.
So I assume you're on lifelong anticoagulation.
Yes, I am.
Well, so that's what's going to alter your PT-INR. I mean, are you on Coumadin or one of the novel drugs?
I'm on Coumadin, and I've been as regular as can be for the longest time. And since the first of the year, I haven't been able to. Like, I had my blood drawn yesterday, and my PT and INR was 1.99, and I'm supposed to be between 2 and 3.
Well, there's a lot of
But
factors you got to get into, which is your diet, because as you know, foods will alter warfarin absorption. But another option is to consider one of the novel anticoagulants, Xarelto or Eliquis.
Yes, that's what I'm thinking is the Eliquis. My wife also takes Eliquis. So.
Yeah, I would look at one of those, and then it's a lot more stable, and you don't have to worry about side effects. So I think we have to go to AnnMarie soon.
Well, let's hope he gets to the right doctor.
Right.
Let's hope he's under the right care. And if he's not under the right care, he better call you at 866-Kolender and make sure that he gets hooked up with the proper doctor that's going to shepherd him down this process. So unfortunately, we don't have any more time to talk about this tonight. So I'd quickly like to thank Dr. Brian Kolender, MD, specialist in prevention, for being here tonight and for being willing to share his expertise and knowledge with regards to not only the prevention of disease, but also on the importance of being proactive and engaging with a practice that provides access to the necessary testing. This show is brought to you by Kolender Medical. I'm your host, AnnMarie Cronin, and we hope that you've gotten some useful information tonight on how to be your own advocate and take charge of your health, whatever your medical journey. Please continue to tune into our shows for the latest medical updates. And thank you for listening to News Talk 760 WJR. Good night and be well.